Homelessness has reached a crisis point. There are more people homeless than there have ever been. The population is aging. People are living and dying on our streets. And this is named as the number one problem in many parts of this country. The UCSF Benioff Homelessness and Housing Initiative is a research and policy initiative based at UCSF. We conduct high-quality, rigorous, nonpartisan, unbiased research to develop evidence-based practices and policies, and then present that research to policymakers, nonprofits, and the general public so that they can act on that research and produce the policies and programs that we need to prevent and end homelessness. One of our core parts is our education program.
Within our BHHI education programs, our mission is to train the next generation of homelessness researchers. Our goal is to have our scholars be as well equipped as possible to conduct rigorous research to end homelessness.
Research helps BHHI's mission in many different sort of avenues. We have conducted really rigorous scientific studies and shown here's the extent of homelessness across the state. Here are the needs, because if we don't know what's going on, we can't improve it.
Rather than a group of scientists sitting around in a room deciding what the questions are, we really are out there in communities with our ears to the ground. We think the only way to get at the root of this problem is to listen to those who are the true experts. Those are the people who themselves are or have been homeless.
We're tackling this from the perspective of evidence and trying to bring to the top of the table what can help to remedy homelessness.
A report sitting on a shelf isn't going to lead to homelessness being prevented. We see our job as really just translating that research to the people who need to hear it. We have daily conversations with policymakers, the general public, to program leaders, and the like. What we try to do is we present it at the local, state, and federal level with recommendations that are based on the research to make sure that they are able to act on what we're finding.
And then it's also educating our community across the state and the nation around what are the drivers of homelessness.
We really are trying to find the answers to the most vexing questions to help come up with the best policies, best programs, and to really change perceptions away from myths and towards the reality on the ground. Whether a community has a lot of homelessness or a little bit of homelessness has everything to do with their housing costs and how out of touch those housing costs are with the wages of low-income households. California is the second worst state in the nation on this measure. We have only 23 units of housing that are available and affordable for every 100 extremely low-income households. That is the underlying driver of homelessness. And we've shown through our research that people, even with the most significant mental health and substance use challenges, can be housed with success without that much expense. This is a problem where, for the most part, in broad strokes, we know exactly what to do, but we haven't scaled those responses. To solve homelessness, we need to provide someone with a home. Our research has shown that that is the only way to end homelessness.
People's living context and whether they're housed, it affects every dimension of their life and is directly linked to their health and well-being.
We know that people experiencing homelessness experience premature mortality at astronomical rates.
The lack of sleep, the repeated trauma and victimization, all of these things contribute to worsening physical and mental health and often creates a downward spiral. We also know that homelessness worsens existing problems.
People cannot be healthy if they don't have a home. That intervention is more powerful than any medication I could prescribe, and housing is healthcare.
It really has to be seen as a right and not a privilege. And we are so focused at the BHHI on preventing and ending homelessness because nobody is served well by a society where so many people are living outside or in shelters. We all thrive when every American can afford a safe, secure place to call home.